Hi everyone, my name is Sabrina Dunkley and today I will be presenting on kleptomania. Kleptomania is an impulse control disorder. Its diagnostic code is F63.2. Kleptomania is a condition in which crime, which is theft, forms a part of its diagnostic criteria. It is characterized by a diminished ability to resist recurrent impulses to steal objects that are not needed for monetary or personal use. The individual with kleptomania often attempts to resist the impulses to steal, and they are aware that the act of stealing is wrong and senseless, yet they cannot resist their urges. The individual may hoard the stolen objects or even return them. The individual will generally avoid stealing when immediate arrest is probable, and they usually do not pre-plan the thefts or fully take into account the chances of being caught. The stealing is done without assistance from or collaboration with others. The DSM-5 criteria are as follows. A. The recurrent failure to resist impulses to steal items, even though they are not needed for personal use or for monetary value. B. A rising and increasing sense of tension immediately before the theft. C. Pleasure, gratification, or relief when committing the theft. D. The stealing is not committed to express anger or vengeance. It is not done in response to a delusion or a hallucination. E. The stealing is not better explained by a conduct disorder, a manic episode, or antisocial personality disorder. Course and prevalence. In the US and Canada, 4 to 24% of people arrested for shoplifting have kleptomania. It is a very rare disorder and is only present in 0.3 to 0.6% of the US population. Women outnumber men with kleptomania at a ratio of 3 to 1. The age of onset varies, but it typically emerges in adolescence. There are 3 typical courses for kleptomania progression. The first is sporadic with brief episodes and long periods of remission. The second is episodic with protracted periods of stealing and periods of remission. The third is chronic with some degree of fluctuation. The disorder can continue for life despite arrests and convictions for stealing or shoplifting. Prognosis. Kleptomania is usually lifelong, but people can regain control over their impulses and stop themselves from stealing with proper treatment and helpful support. Kleptomania is associated with an increased risk for suicide attempts. For individuals with kleptomania, the disorder can cause legal, family, career, and personal difficulties, thus clinically and functionally impairing them. Many people with kleptomania live lives of secret shame because they're afraid to seek mental health treatment. Cultural considerations. About 2/3 of people with kleptomania are women. Compared with men, women with kleptomania were more likely to be married, to have a later age at shoplifting onset, to steal household items, to hoard stolen items, and to have an eating disorder. And women were less likely to steal electronic goods and have another impulse control disorder when compared with men. Kleptomania can begin in childhood, adolescence, or adulthood, and in rare cases late adulthood, but the common age of onset is adolescence. Shoplifting and kleptomania is categorically different than ordinary stealing. Due to the nature of the disorder, which is a crime, there are high levels of arrest and incarceration within this population. Etiology. Kleptomania is described in both the medical and legal literature for centuries, dating back to the early 19th century, when the Swiss physician Mathieu, who worked with the insane population, wrote of a unique madness characterized by the tendency to steal without motive and without necessity. Mathieu described the behavior in 1816 under the term clopomanie, but it was changed to kleptomania, klepto meaning to steal, and mania meaning craze or stealing madness. It was first diagnosed in the psychiatric community in 1838. It was listed in the DSM-4 with the impulse control disorders not elsewhere classified, but changed in the DSM-5 just to its own category under impulse control disorders. There are no known causes of kleptomania, but it may be linked to problems with the naturally occurring brain chemical, serotonin, the brain's opioid reward system, and learned habits, which have a difficult cycle of breaking. Theories. The theory of addiction, neurotransmitter pathways associated with behavioral addictions, including those associated with the serotonin, dopamine, and opioid systems, play a role in kleptomania. Pathophysiology theory. Kleptomania is highly associated with mood disorders and anxiety spectrum disorders, and its response to SSRIs suggests a commonality with mood and anxiety disorders. Psychoanalytic theory. links compulsive stealing to childhood trauma and neglectful or abusive parents. It theorizes that the stealing may symbolize repossessing the losses of childhood. Other features of kleptomania. Having a blood relative, such as a parent or a sibling with kleptomania or addictive disorders, and having another mental illness, such as anxiety, depression, or a substance use disorder, can increase the risk of having kleptomania. There is a higher rate of alcohol use disorders in first-degree relatives of individuals with kleptomania than there are in the general population. People with kleptomania typically fear being apprehended and often feel depressed or guilty about the thefts that they commit. In kleptomania, objects are stolen despite the fact that they are typically of little value to the individual, who could have afforded to pay for them, and often gives them away or discards them. Assessments for kleptomania. First, there is the Kleptomania Symptoms Assessment Scale, which is a brief 11-item self-report questionnaire. Next, there is the Yale-Brown Obsessive-Compulsive Scale, modified for kleptomania, which is an extended self-report questionnaire. Next, there's the Structured Clinical Interview for Kleptomania, which is, of course, a structured interview with a set of questions between a clinician and a patient. Patients often reject a diagnosis of kleptomania, perceiving their behavior more as an expression of a moral deviation rather than a treatable condition, which complicates the process of seeking professional help and further hinders one's treatment. Differential diagnoses for kleptomania. First, of course, there's ordinary theft. Kleptomania must be distinguished from ordinary acts of theft or shoplifting, because ordinary theft, whether it is planned or impulsive, is deliberate and is motivated by the usefulness of the object or its monetary worth. People can also steal on a dare, as an act of rebellion, or as a rite of passage. A kleptomania diagnosis is not made unless other characteristic features of kleptomania are also present, because kleptomania is so rare, whereas shoplifting is relatively common. Then there can be malingering, so individuals may stimulate the symptoms of kleptomania in order to avoid criminal prosecution. Then there's antisocial personality disorder and conduct disorder. Antisocial personality disorder and conduct disorder are distinguished from kleptomania by a general pattern of antisocial behavior, rather than just specifically impulses and urges to steal in kleptomania. Manic episodes, psychotic episodes, and major neurocognitive disorders. Kleptomania should be distinguished from intentional or inadvertent stealing that may occur during a manic episode, in response to delusions or hallucinations, like in schizophrenia, or as a result of a major neurocognitive disorder. Comorbidities. Other complications and conditions that are associated with kleptomania are as follows. Other impulse control disorders, such as compulsive gambling or shopping, as well as disruptive or conduct disorders. Compulsive buying, alcohol or other substance use and abuse, personality disorders, eating disorders, depression, especially major depressive disorder, bipolar disorder, anxiety disorders, suicidal thoughts and behaviors. Treatments. Treatment with medicine and skill-building therapy that focus on dealing with urges may help to end the cycle of compulsive stealing for kleptomaniacs. Most programs combine psychopharmacological and psychotherapeutic approaches. For the psychopharmacological, there are medications that mostly focus on the treatment of the psychiatric comorbidities frequently seen in kleptomania. So for someone with depression, comorbid with kleptomania, they might use SSRIs. Next would be opioid antagonists such as naltrexone, which helps prevent relapses into alcohol or drug abuse. For psychotherapeutic approaches, there's behavioral therapy and cognitive behavioral therapy. There's psychotherapy and psychodynamic therapy. These therapies can help the patient identify unhealthy behaviors and problematic thinking patterns while learning to form new habits. Now we get into our case study. So for our case study, Cassie, a 25-year-old gym receptionist, wants to pick things up and frequently takes items from work, even when she does not need them. She also frequently takes small items from the department store that she does not need, and she could afford to pay for otherwise. She has been experiencing this problem for the last 3 years, and after informing her superiors and her fiancé, she decided to consult a psychiatrist due to the immense guilt she feels over her stealing. Immediately before taking the item, Cassie feels a sense of anxiety and tension, but during and afterward, she feels a sense of relief and pleasure. So for a discussion of the case study, based on the diagnostic criteria of kleptomania, for criteria A, Cassie cannot resist her impulses and urges to steal, as she takes things both from work and the department store, despite not needing them or being able to afford them. Criteria B, Cassie feels a sense of anxiety and tension before the theft. Criteria C, Cassie feels a sense of relief and pleasure when committing the theft and after committing the theft. D, Cassie's stealing is not to express anger or vengeance and is not in response to a delusion or hallucination. E, Cassie's stealing is not better explained by a conduct disorder, a manic episode, or by antisocial personality disorder. And a differential diagnosis that could be considered would be generalized anxiety disorder, which is F41.1, due to the tension, apprehension, anxiety, and guilt that Cassie feels. However, these feelings are only related to her stealing, hence her diagnosis of kleptomania. Lastly, this final slide here is all the references that I used for my presentation. Thank you so much for listening. I appreciate it, and I hope everybody has a wonderful rest of the semester. Happy holidays.